Hi, my name is Beth. I'm an alcoholic addict. I decided that I would do a video blog. I know you can't see me very well because of the reflection of my glasses from the computer screen, but if I don't have my glasses on, I can't see. So I also have a dual diagnosis. I'm bipolar with schizophrenic tendencies. There's also other mumbo jumbo from psychology that I have that probably isn't really that important. But my two major ones that I have issues with is bipolar and schizophrenia. When people hear about being bipolar or having schizophrenia, they get scared. And one question that was asked to me was, "Are you going to yell at me? Are you going to be violent towards me?" And I had to say, what you see on TV is not an accurate description of what I am. What I am is not my diagnosis. What I am primarily is an addict. I was about a majority of my life a binge drinker and a big partier. There was a period in my life where I was going through about a gallon of vodka every 2 days, and I had to drink to survive. If I stopped drinking, I went through detox, and I knew that if I quit, it probably was going to kill me. My drugs of choice were uppers. They were methamphetamines and cocaine and Ritalin and Adderall. Anything that I could put up my nose, I would do. I was not an IV drug user, even though I thought about trying it once. And thank God I did not, because the girl that I was going to share the needle with had hepatitis. I've done a lot of things in my life I'm not proud of. But I am sober today, and tomorrow is my 1-month sober birthday. I have been sober before for years. I did not obsess over the time of sobriety because I felt that if I obsessed over it, then I would obsess over other people's time of sobriety and start to compare. Because being sober is not a competition with other sobriety members of AA or NA or any other factor of the anonymous community. Where I go to meetings, they allow anyone to enter those doors, whether you are an alcoholic or an addict of any type of drug. I have been to meetings where if you are an alcoholic, if you are an addict of a drug and you go to AA, they say this is not the meeting for you. You need to go to NA. I don't believe that is right. That if you decide to go to a meeting and you need to go to a meeting, that you should be accepted anywhere. They do that here. I have started to want to go to meetings now, where before I didn't want to go and I felt like it was a bother, because it goes into my routine. I have a routine that I have to follow with my bipolar and my schizophrenia. Excuse me. I have a routine that I have to follow, and if I don't follow that routine, it can set me off into a manic or depressive state that I am never sure when it is going to end. And I just came out of a very long manic phase where I used again and got into a lot of trouble with my family. Not with the law. I was lucky. I have never gotten arrested. I never got a DUI. I should have gotten a DUI all the times I drove drunk, and probably should have been arrested for drugs, but I never did. That higher power was looking out for me for something. I'm still trying to figure out what exactly my purpose is here on this earth. But with time, I think that will come. That's what I'm learning when I go to AA, is that it is one day at a time. Sometimes with me right now, it's 1 minute at a time. I'm having a difficult day today. I have chronic pain. I fell in 2009 at a job and hurt my SI joint. And I had gastric surgery about 2.5 years ago and lost 125 pounds. And honestly, I was in a lot of pain with my SI joint injury when I was 286. But with all the weight loss and sitting for periods of time in a chair or whatever, now that I weigh 161 pounds, I feel like I'm in more pain now than I was then before in 2009. And I can't take anything for it. The only thing I can take now is Aleve or ibuprofen and put a heating pad on it, and that doesn't even begin to take away the pain. They have me flagged in the hospital as an addict, so if I even go there for any type of problem, it could be, a couple years ago I thought I was having a heart attack, and it was a gallbladder attack. They wouldn't give me anything besides ibuprofen because they thought I was there to get painkillers, and that wasn't even my drug of choice. Which made me fucking pissed off as hell, because there again, I was being judged for something that was not even an issue at that time. I was sober. I had been clean for years. And I feel like I'm always going to have that label. That label of you're an addict, and if you want help at any hospital, there's that stigma. And I have a bunch of tattoos, so there again, there's that stigma. They judge you before you even sit down in the fucking chair. Can't remember if I said tomorrow's my 1 month sobriety day. I call it my 1 month birthday. Kind of like your unbirthday on Alice in Wonderland. That's kind of how I consider it. Being a dual diagnosis and an alcoholic and an addict, that's primarily why I used. Because if I got high on any type of drug, the voices and the hallucinations stopped. If I got drunk to a certain point of being intoxicated, they stopped. If I got too drunk, I got depressed and self-mutilated. So there was always that borderline of I can't get too drunk, I want to hurt myself, and then if I get too high, am I going to OD? Because I've gone to the hospital a few times for getting my stomach pumped, getting that chalky, icky, black shit. Oh, just making me think about it makes my mouth water. I've gone to the hospital so many times for stitches, for cutting myself. There were signs when I was young that something was up with my brain. I call it my special brain. The past couple of weeks I have had withdrawal symptoms from one of my medications, because my doctor thought that combined with another med was sending me into a manic state again. And so we slowly reduced that medication, and it started to give me akathisia, which is common in people that have been on antipsychotics for a long period of time. It is that severe inside feeling of not being able to sit still. I kind of compare it to if you've ever seen anybody that sits and rocks and rocks and rocks and rocks and rocks, and they just can't sit still. I felt like my insides were just on boil. On Monday, I had to get out of the house. I had to leave. I called my partner, and I had to go. If I did not get out of the house and drive, I was going to go insane. You have to excuse me, my back hurts. If I didn't leave, I was going to run away. I just needed to run. So I ran to my doctor's office, which is 45 miles away. She wasn't in. Ended up putting me on a pill that they usually put people with Parkinson's on, and people that have akathisia from the side effects. So then I finally got to see her yesterday. They put me back on the pill that I was having withdrawals from. And then now I am taking that one other pill for the side effect of the one I was having withdrawals from. Morning and night. And it knocks me on my fucking ass. And I hate feeling doped up. There was a time where I was seeing another psychiatrist, and he had me on so much fucking medication, and I was going through ECTs, that I was literally a walking zombie. You could not have a conversation with me. I could not start a conversation with you. I did not smile. I had no facial expressions. Even if I tried, nothing happened. I was boring. And during that phase, I used, because I felt absolutely nothing. No emotion, no physical anything, nothing. Got hospitalized a few times for that. Went through a detox program, went through a treatment program. I thought, well, maybe I'll go to AA a few times. Well, you know, some people say it's kind of like a cult. I was one of them. But this time feels different. This time feels like maybe I can do it this time. Maybe I can prove to myself that staying completely sober from any type of drugs and alcohol, and that includes bud, even though I absolutely love marijuana and think that it should be legal everywhere, especially for those people that really need it, like, you know, chronic pain, cancer patients, and all that. But to be completely sober from any recreational drug use or alcohol is going to be hard. It's going to be really hard for me. Today is hard. I keep thinking with what one AA member said. Some days are 1 minute to 1 hour to 2 hours to a whole day. And stop planning for tomorrow, because you don't know what's going to happen tomorrow. Which really sucks for me, because I'm a planner. I don't know if anybody's going to actually watch this video, or if I'm just rambling and I needed somebody to talk to and it's myself. There's a meeting in town tonight and I'm going to go. But my partner, I don't have it on. I took it off when I took a shower. My partner made me a necklace for my 24-hour chip. And I usually wear it. I wear it every day. But today I took a shower and I forgot to put it back on. If you can hold that thought for like 2 seconds. I will run and I will get it. Just pause for 1 second. Nobody's here. Nobody's here, Phoebe. Sorry, that was my dogs you were hearing. Okay, this is my 24-hour chip. Well, she first made it into a bracelet, but it wouldn't stay on. So I hippified it, as she called it, and made it into a necklace that I wear every day to remind me that it is a 24-hour. It is a 1 day at a time, and I'm excited that tomorrow is that 30 days. And I don't know how I got there, but I did. But with the support and help of family and the support of AA, they didn't close the door on me. They let me walk in when I needed them. So, with that, I will pass.